The Health Insurance Portability and Accountability Act of 1996, HIPAA, includes provisions related to insurance, privacy, security, transactions, and code sets. In this training video, we are going to focus on the privacy section of HIPAA. HIPAA privacy regulations were effective since April 14, 2003. HIPAA privacy and security rules were amended as HITECH Act in the American Recovery and Reinvestment Act (ARA) of 2009. Today we are going to learn how HIPAA relates to patient privacy, who does HIPAA apply to, what is the HIPAA component of the HITECH Act and how does it affect our organization, what are the penalties of not complying with the HITECH Act, and what are the precautions to be taken so that as employees of healthcare organization we do not break HIPAA regulations. How HIPAA relates to patient privacy. HIPAA protects any unauthorized disclosure of any personally identifiable health information, also called as Protected Health Information or PHI, that pertains to a consumer of healthcare services. What is PHI? PHI is personal and health information that is created, received, or maintained by a healthcare provider or health plan. It can be written, spoken, or electronic. It must include at least one of the 18 personal health identifiers like name, birth date, address, telephone number, etc. Who does HIPAA apply to? HIPAA applies to everyone who interacts with patients and handles PHI. It includes employees, students, and volunteers. It also applies to covered entities like health plan, hospitals, and healthcare providers. It applies to business associates like accounting firms, law firms, billing companies, etc. who handle protected health information of healthcare consumer. What is the HIPAA component of HITECH Act and how does it affect an organization such as ours? The Health Information Technology for Economic and Clinical Health Act, HITECH Act, is a part of ARA 2009. The HITECH Act widens the scope of privacy and security protections available under HIPAA. It increases the potential legal liability for not compliance, and it provides more enforcement. It is enforced since 17 February 2010. As per the HITECH Act, business associates face government penalties if they fail to comply with HIPAA regulations. There are breach notification requirements in place, which are effective as of 23 September 2009. Organizations are also subject to penalties for violations after 22 Feb 2010. The civil penalties for HIPAA violations have increased, and government is required to investigate complaints of privacy and security breaches. The penalties for not complying with the HITECH Act are civil penalties of $100 per violation. The penalties can be cumulative if there are multiple violations by the same individual. The maximum civil penalties are $25,000 per year per person per standard. The criminal penalties are up to $250,000 and 10 years imprisonment may be imposed for knowingly and improperly disclosing information or obtaining information under false pretenses, with higher penalties reserved for violations designed for financial gain or malicious intent. In addition, state laws may impose additional penalties for the same offences, and most states would also allow common law suits for torts such as invasion of privacy and infliction of emotional distress. Steps to be followed by the employees in order to comply with HIPAA regulations. Do not discuss the personal health information of patients in public places. Example, hospital elevators, corridors, nurses' stations, cafeteria, etc. If you happen to overhear patient information, keep the information to yourself. Access only the minimum information you need to do your job. Keep information secured. Log off your personal computers when not on desk. Never share your system ID or computer password. Keep the patient health information in lock and key. Never have PHI on your desks or monitors when you are away from your workstation. Keep the employee personal information and health information separate. Report any suspected privacy or security violations. And lastly, educate your co-workers about HIPAA regulations. Now let's do a quick recap of what we have learned.
PHI is personal and health information that is created, received or maintained by a healthcare provider or health plan. It is written, spoken or electronic and includes at least one of the 18 personal identifiers. When dealing with PHI, you may look at a person's PHI only if you need it to do your job. Use a person's PHI only if you need it to do your job. Give a person's PHI to others only when it is necessary for them to do their job. And talk to others about a person's PHI only if it is necessary to do your job. HIPAA applies anytime you may see or hear health, financial or confidential information with HIPAA PHI identifiers, and whenever you use a computer or electronic device which stores and or transmits information. HIPAA applies to everyone. It applies to you all the time.
Always remember the HIPAA golden rule. What you see here, what you hear here, must remain here when you leave here. Thank you.